Hello, listeners. Before we begin today's episode, I want to share an important update with you. The PAOS Las Vegas On-Demand CME package is officially here. We're bringing you on-demand access to all of our 2025 annual conference lectures designed to elevate your orthopedic practice. To start us off, we're giving you a free preview with the November video of the month, Ortho-Oncology, What Not to Miss, presented by Dr. John DeVries. Dr. DeVries' lecture dives into the red flags, referral pathways, and clinical pearls every orthopedic PA should know when encountering potential oncologic cases. It's a must-watch for anyone committed to early detection and optimal patient outcomes. Whether you missed the meeting or want to revisit your favorite talks, PAOS On Demand AV delivers the full experience. Anytime, anywhere. Go to the PAOS.org Learning Center, where you can purchase discounted AV and self-assessment exams to meet your year-end CME needs. Welcome to the OrthoPAC podcast with your hosts Sam Dyer, Chuck Dowell, and Miles Gilbreth. Please join us as we attempt to fill in the gaps between education, current events, and real-world practice.
Hello, everybody. Welcome back to the podcast. My name's Chuck Dowell. I'll be the host for this episode. Today, I'm joined by Laura Goble. Laura gave an excellent presentation at our most recent PAOS meeting in Las Vegas regarding sports specialization. A lot of our listeners are kind of early new grad into practice, PAs. I'm big on mechanism of injury, and you mentioned the plant leg. So I'm very big on having them actually show me the mechanism of the action they're doing, and then trying to think of that biomechanically of what stresses that's putting and where that's putting the stresses on and how that could potentially be causing injury, because I think that's important. Not everybody that walks in with anterior knee pain is having Osgood-Schlatters. They could be having, as you said, an apophysitis or kind of a physeal injury to the distal femur because of rotational overstress to the area. So I'm big on that. And then also females mature quicker than males. So most of the time, the time frames to maturing are, what we think 12 to 14 in females and 14 to 16 in males, or somewhere around that range.
Mm-hmm.
So I think it's important to take that into consideration. If a 12-year-old comes in complaining of pain, they probably, have more risk of apophysitis because they haven't had growth plate closure yet than compared to a 12-year-old female who may be treated slightly different.
Yeah, and I couldn't agree with you more about the mechanism of injury. I mean, I remember in PA school, they kept talking to us about listen to your history. 70% of your diagnosis will come from the history. Sometimes I feel like in orthopedics, it's even more than 70%, because if you can get the mechanism, they show you the video of what happened, or they can describe in detail what's going on with the joint or how it moved, it can clue you in on how to tailor your exam and your radiology studies appropriately to just be able to navigate the diagnosis.
Yeah, I think we talk and teach this a lot. The history and the mechanism of injury, as you said, probably gives you 90% of your information. And your physical exam, your X-rays, and your MRI are really just to confirm the diagnosis. Most of the time you have the diagnosis based upon that conversation, but you have to ask the right questions during that conversation to be able to get that diagnosis, which sometimes can be the tricky part to learn.
Yes.
I think another big thing, and maybe you can help with this a little bit, is oftentimes these apophysitis or these growth plate injuries, there's no change on X-ray. We will see changes on MRIs and whether an MRI is necessary or not, but there's oftentimes no changes on X-rays. It's based upon exam and a history. How do you approach that? I treat a lot of kids more aggressively than I treat adults because I know that this can be the case, but how do you approach a normal X-ray but a painful elbow in an overhead throwing athlete?
So one thing I love about treating young kids and even teens is typically they're not good at faking it. And so sometimes just making sure you're doing a good exam bilaterally, checking both sides. A palpation alone over the growth plate typically can give things away. And then sometimes doing a contralateral X-ray, you can see a hint of widening more on one side than the other. So don't be afraid to order that opposing X-ray.
Yeah, and as you said, kids are resilient. I tell a lot of parents, any kid with pain for 3 to 5 days or more, it worries me because most kids will push through a lot of things. And the number two question I ask most youth, adolescents and athletes is, are you able to participate in sports? And if a kid comes and sees me and says, my knee hurts so bad I can't play this sport I love, again, that heightens my senses of, even though the x-rays are normal, something's going on here. Because unless there's a psychological or social reason they don't want to participate in the sport, most kids want to play. They want to play the
Yes.
sport.
Yes. Which
And
makes
so,
me then funner to treat.
correct. They're eager to get back. Yeah, exactly. They're very eager to get back. So when we kind of dive into that a little bit more, how do you approach these conversations? We mentioned this before, but let's say you have a 12-year-old overhead throwing athlete that comes in and sees you in the clinic and you think they have thrower's elbow or thrower's shoulder, and you're talking about shutting them down. Talk us through that conversation with the parents and like, what do you do? Do you order MRI on all these patients? Do you mobilize them? How do you approach that?
I don't order a lot of MRIs in my pediatric population unless there's been sudden trauma because so much of it is overuse. Now, in my college athletes who are having short time frames to get back, I usually tend to lean a little heavier on MRI just so I can help navigate their treatment aggressively. But in the adolescent realm, again, it really, most of these athletes can get so much better just with rest. And I also try to preface, listen, if you can give me 2, 3 weeks, we'll focus on the rest, change these things. And I try to make sure to tell them, if you're not better, by all means, I want to get to the bottom of it. And we will certainly order the MRI if that comes to it. But most of the time, giving the body adequate rest makes such a big difference. And I'll never forget having a conversation. 11-year-old boy, exactly with this, had overuse injury of the elbow, apophysitis of the medial epicondyle, and they were going to a travel ball tournament in Myrtle Beach in the summertime. And the mom was so nervous and worried that he would not be able to play. And I finally just said, listen, I think he'd be okay to be a DH. He could be a designated runner, but I really just don't think he needs to pitch this weekend. Or she's like, but we can't get our money back from the trip. We can't do anything else. I said, well, why don't you go to the beach as a family, take a break, get some rest? And it was almost like this foreign concept. And I get it. I get it. You get in the midst of it, you get into the competition and the tournaments and you're doing well. The last thing you want to do is have to watch your kid miss out or shut down. But think of the time frame. These are 11, 12, 13-year-old kids. I want them to have fun, enjoy their sport, but there's so much to life. And if we leave them with something that's a devastating injury that could result in surgery, and we would have just let them rest for a couple of weeks, I do try to take time to just paint the bigger picture if I can for a moment.
Yeah, I agree with that 100%. I think it's important to paint that picture, and you're completely right. It's interesting to me, and probably the same for you in your practice, and probably a lot of our listeners, that most of these office visits happen with some kind of tournament around them. Almost 90% of the time, they come in and see me, and I ask the question, do you have an upcoming tournament or trip? And they always have something within 2 weeks, because the concern is always, hey, this trip we paid for is coming up, or this big tournament's coming up, and you're still having pain. We should go see somebody about this. So I always ask that question, and the answer is always, yeah, we have something coming up.
Yeah. And then I do try to utilize the appointments to spend a brief moment on prevention and reiterating that the parent is their advocate for their child. They are the ones that can help protect them from overuse. They are still dictating the schedule. They are still the ones that are choosing the teams, and they are still the ones that are communicating for their minor to the coaches and staff that are helping out and just saying, as a family, you may have to make some decisions that are different. And it may mean that twice a year, your child is taking a 2 week break or a 3 week break from anything to give their body rest that it needs. And it's hard because, again, the overlap between school and travel ball and all the activities, it makes it hard to rest. I mean, I don't know about you, but when growing up, we went from basketball to volleyball to softball, but we had usually 1 to 2 weeks of rest in between each sport. And I think that naturally gave our body the rest. We didn't have weekend tournaments. Sometimes we'd get Wednesday nights off, so it was almost like our schedule was more built for the recovery aspect that the body needs.
Yeah, 100%. And like you said, I think also, you go from an overhead throwing sport of, baseball, softball to a lower extremity dominant sport like, soccer, whatever it may be. And that just naturally gives those joints their rest as well. I think sometimes based upon the conversation and my kind of feeling of the conversation, I'll take the decision making out of the athletes or parents' hands. Sometimes if I feel like they don't want to, or, they're all concerned about it, I'll just say, well, I think we should take you out of sports completely, put you in a sling, put you in a boot, or do something more aggressive than I would with other athletes based upon kind of how that conversation's going. Do you feel like that's the way as well?
Yes. And I often say, you know what? Blame me. Let the coach
Yeah.
be mad at me. Don't try to take this yourself. Like, I'm the one that's making this decision for you and your family because I want what's best for you and your body.
100%. And I say the same thing. Like, use me as the target. Everybody can blame me. Everybody can be bad at me. Exactly. That's my responsibility to make that decision, but I'll take that decision out of your hands. And yeah. And I think as a provider, we have to do that at times and write that note that says, based upon our recommendations, they're out of sports. And some athletes, you could see the relief on their face. Oh, that's great. I don't have to worry about the coach giving me a hard time because I could just say that, the provider told me I had to. And that will give them a lot of relief, which
Yes.
which can be helpful.
Yes. And I mean, in our community, we're very involved with athletic training staff. They have open communication with us. And so it's easy for me to say, I'll talk to your trainer. Let me help you with this. They can help handle the coach. Like, let the adults help protect the child.
And so what are some resources? So if you kind of recommend resources regarding these overuse injuries, are there specific websites that you recommend to, families, coaches, athletes to go look at for more information?
So there are some good ones out there. One that's kind of a general one is called Play, Stay, Thrive, and it's a youth sports toolkit that was developed by the American Medical Society for Sports Medicine, and it's got education for parents and those involved in youth sports. It talks about how young athletes should have at least 1 day off from sports a week and 2 to 3 months off per year from training for a particular sport. There's another great one called Pitch Smart. This one's great. It was guidelines actually set up by the Major League Baseball Association and USA Baseball. And they've had some very specific statements of they recommend that single sport specialization be delayed at least until high school, preferably till college. They talk about the benefits of maintaining baseball specific strength and conditioning in the off season. It talks about how they have some retrospective studies of professional baseball players that showed that those who specialize solely in baseball prior to high school actually have higher rates of injury. And then another one is they talk about pitch counts. And there's some good resources out there where they give you pitch counts according to the age and say, okay, these are the daily max of pitches. If you pitched yesterday and you are 11, when is it safe for you to pitch again? And on that day, how many pitches can you throw? The statistics from PitchMark, several of the things that they said were 45% of kids are pitching in leagues with no pitch count or limit, which is terrifying. 30% are pitching on multiple teams with overlapping seasons. So you may have each one doing pitch counts, but unless you are counting for your child, then it may not be tallied correctly. 13% are pitching competitive baseball for more than 8 months per year because they keep thinking, oh, we got to get reps in to get better. 43% are pitching on consecutive games, and 19% are pitching in multiple games on the same day. So there are some fantastic resources out there for baseball. And then I think the American Orthopedic Society for Sports Medicine has actually put together some early sports specialization consensus statements. And so I think there's more research and more meetings that are occurring about this topic. And they just keep coming back with multi-sport is better, rest is better, keep focusing on the loading patterns and distinct overuse injuries to try to prevent them based upon the sports.
Yeah, that's all excellent. I think those are all great resources, and that's a hard conversation to tell the athlete. The answer is the less you play the sport, probably the better you'll be at the sport, or the less you pitch, or the more you do other types of training, the better that you could potentially be at it. But sometimes it's worth having that conversation with them. So that's excellent. Those are all great resources. Anything that we missed? Anything that you wanted to cover that we didn't cover?
I just always want providers to make sure that they are being advocate for their athletes, educating both the athlete and the parent. Because I mean, I had a colleague one time say, Laura, I just had no idea. They didn't even realize that these statistics were out there. They thought they were only doing what was best for their child. And I do want to share one final one with you because unfortunately it's staggering, but it was saying that not necessarily PAs, athletes who are coming from high median income families of more than 70,000 per year and who have private insurance are actually at risk of increased risk for early sports specialization. So that was kind of like well, wait a second. As a provider, I meet those qualifications. I've got 2 girls that we hope to be involved in sports, and I need to be their advocate because we are the perfect scenario for being at risk for being in an early sports specialization environment.
Wow. Yeah, that's very interesting. I didn't know that statistic, but very interesting. I think you as well as myself, I have 2 little ones, a boy and a girl, and I know the statistics, and I've been around this enough where the first sport I got my kids into is gymnastics, just to teach them, proprioception and neuromuscular balance, and that's allowed them to be better, athletes throughout the other sports they've been trying to play. So interesting statistics. So, well, I appreciate your time. Thank you so much for coming on the podcast. If anybody or any of our listeners are interested, all of the videos from the Las Vegas PAOS conference are available on the website at paos.org, and they can be a great resource for CME. So if you weren't able to attend the conference, you can definitely go there and purchase the videos and use your CME money for that, and listen to Laura's talk, as well as a lot of great talks that were done there. So we appreciate your time. Thanks so much for coming on.
Thank you again so much. I really enjoyed it.